introduction. And before I even get started, Jenny, thank you so much for hosting this. I think this is such a great opportunity for all the clinicians to come together and just talk and present on important topics. So thank you so much for having all of us here, especially because this is a geriatric summit. Our focus for today is going to be on geriatrics because it is such an important patient population to work with, right? In general, a lot of people who work in a home health setting are more likely to take this exam. So if you are somebody who works in the home health setting, this is definitely a good option for you, because in general, home health is for patients who cannot get out of the house, and the job opportunity is it's essentially, even if you're a private practice, even if you have a private practice, you can always promote that you offer the highest level of care and you're keeping up with the latest evidence-based practice and research. Of course, you get to earn CEUs with it, and you get to enter the prestigious pool of board-certified clinicians. Mission is valid for 10 years. Of course, every 3 years, you have to do some activity to prove that you are still committed to the geriatric population and you're still, seeing the geriatric population. But and usually this exam happens in February or March of every year. So if you look at the next year, it's going to happen. It's a window during which you can take the exam.
Of promoting positive partnerships with Parkinson's caregivers. As Dr. Jenny said, my passion has always been working with individuals with Parkinson's disease and other neurodegenerative disorders. And with that comes, you're not frustrated, a whole gamut of emotions that may change from day to day. They may not know anything about Parkinson's disease, especially the non-motor symptoms that we're going to be talking about a little bit. They may not be a person who's naturally a nurturer, right? Some people are wired like that and some people are not. Keeping up with me. And then help facilitate positive interactions beyond yourself as well. Really put them in situations where they're around, friends, other family members, where people also might notice like, wow, you sound great today. You're moving great. Whatever that may be. Sometimes I see care partners jumping in too early to help a person out of a chair, out of the car, to do some activity. I'm like, stop. They can do it. I've seen them do it in therapy. Let's give them more time to try that. Allow them to take on roles that they might have stopped doing after Parkinson's disease. Sometimes you hear, well, it's just faster for me to do, clean the kitchen or do the dishes or do the laundry. Well, wait, you're taking away that role for them. It might take longer, but allow them to still participate in that occupation.
You see on the left side over here, which is a picture of an MRI, and this was taken maybe about 2 months or so after I injured my knee. So in social media, everything is sort of fast forward. Everything seems like it's instantly done. And when you see the picture on the right side, it's a picture of my daughter and I running through the finish line on our first movement makes morphine is one of my other mantras. Pace not race to help reduce the boom-bust cycle. And then planting seeds should be done by all clinical staff to help cultivate that environment of rich learning, to use safe words. And that's where Pain Neuroscience Education Plus comes in. It's not just going to be Pain Neuroscience Education or PNE, it's going to be PNE Plus. And it's going to be plus movement, plus reinforcement, that carries over this learning really well. Pain to the body, it's so intense that it's distracting them now. The amygdala, fear conditioning, addiction, this changes all kinds and promotes all kinds of stress chemicals to become present in our system, to become created in our system. The sensory cortex, our 2-point discrimination. That's why in treatment we also test that in there, and we try to improve that in there as far as treatment goes. The hypothalamus, the thalamus, our stress responses, our autonomic regulation. We're always on fight or flight, and just tell them how lucky you both are, right in there. Now, what kind of words are we using? I often hear these type of words in our clinic over here. And thank you also for Dr. Jared Hall for being able to allow me to use this infographic in here. I often hear wear and tear, bone on bone, pelvis is out of place, you got bone on.
So we are here together with Oscar, and we're going to be presenting on lymphedema. So parents will seek out to treat them as children, but when there is not a whole lot of information about it, that can be an issue. So upper extremity, you may see it in the just one arm, and in the bottom left, you see just one extremity, although the other extremity is also beginning to manifest some static and also fat deposit that is occurring. So she's in the later stages. And keep in mind that this is attributed a lot of times to predominantly female, and it's hormone driven, and as well as, you know, it can progress with every hormonal event. So whether it's at puberty, childbirth, or even being on birth.
Here, a couple of videos, right? A typical day at our center. Now, we've been doing this since 2001. So we have thousands and thousands of videos of patients. So yes, I'm showing you here a little bit of the extreme, okay? The extreme, because not everybody can work with certain patients like this, okay? Because it's difficult. You ask yourself, where do I start? What do I do with this gentleman? You see on the left side, you know.
So it is lymphedema, phlebolymphedema, meaning chronic venous insufficiency. So you can see all these little papillomas on the skin that are.
But does the same results. The difference is that I can put this 3M compression.
Talking about neuropathy, let's do a little bit of a review, right? What is a peripheral neuropathy and what are peripheral nerves? So when we talk about peripheral neuropathy, think about peripheral neuropathy, just like Dr. Youssef said earlier, right? Some of the patients are going to complain of tingling sensations in the hands and the feet. Sometimes some of the patients are presenting, right? When you're doing your sensory testing, they're presenting as a dermatome. That's probably not a neuropathy. Most likely the lesion is either in the spinal cord or it is a radiculopathy, right? It's getting trapped in the nerve root. Think about demyelinating. That means the lesion will be here on the myelin sheets, not on the axon itself, but the myelins, right? Like for example, in GBS, right? The demyelinating neuropathies, it attacks the myelins that covers the axons. But then there is another type called axonopathy. So that means in that type of neuropathy, the lesion is in the axon. It's not here, right? It's not on the myelin covering the axon. It's in the axon itself. So any of those exercises will improve your CBIN, and those modalities will also improve the signs and symptoms of patients with CBIN. And that's it for CBIN.
Requiring mechanical ventilation in the acute phase, and literature suggests that having an age greater than 60 to 70 years old is also. And as it does progress more proximal, this is where you can start to see the respiratory complications as well. Again, typically by the 4th week is when patients will reach the nadir, which would be a scale. And then the modified EGOS is again kind of combining these scales where it looks at age in the presence of diarrhea again. And then it also considers the, so just conducting a comprehensive exam as we know. So looking at sensation, the light touch, proprioception, protective sensation, again, be in the acute phase of GBS. So there's 17 participants in this study. They tried to get them within a 2-week onset steroid therapies. They implanted these devices bilaterally around the sciatic nerves, femoral nerve, and brachial plexus.
You can't escape diabetes in any setting that you treat, any population that you're going to treat. This is information from the American Diabetes Association. Products, it creates a lot of inflammatory cytokines, a lot of inflammation in the body. This can also lead to oxidative stress. So this is going to damage the actual axon. The term can increase the risk of exercise-induced injury or adverse events through decreased cardiac responsiveness to exercise. The little blood vessels in our retina, and that over time will cause those blood vessels to become stenotic, and that in the middle and at minimum before and after. Noticing if there's any exercise per week, 75 to 150 minutes of vigorous and aerobic exercise plus resistive strength training, super effective sensation utilizing the 5.07 Weinstein monofilament, and vibration. Like, do they understand the implications of that? They might not. So it's a really good entry point, especially.
It is becoming popular. Oh, I'm having trouble trying to advance this. I would term that I was a jack of all trades and master of none. And as orthopedic practice begins to fail, the contributing conditions are, we notice that they have reduced mobility, and this all leads to a compromise in the quality of life. These people are very, very susceptible to compression fracture, and our course is designed in an exercise program that believes, and they trust our judgment. I always initially say to individuals that I'm not a pharmacist, so we have to do a really good job of marketing and promoting ourselves to the physician base, and certainly doing community and services to educate 7 days per week. So most of his research that you'll read is based on up and tested for osteoporosis. No, I haven't. Sometimes we send them back to the doctor. We recommend them getting a DEXA scan. Well, you're going to try to counteract that with your muscles. So for every reaction, there's
practicing as an orthopedic therapist, so I love treating patients with pain, and most of the patients that I treat are low back pain, cervical pain.
Which is your fourth page, fourth slide.
Having some issues here.
You can make it slideshow, and
it's like, do you feel something falling down? Because stress urinary incontinence is always related to it, because the bowel cannot come out because it's so dry and big. So we wanted type 4 and type 5, 6, and 7 to protect your posture. And then the small intestine or the large intestine from the upper abdomen, you have your transversus abdominis, you have your external oblique, your internal oblique. All of those close the abdomen in order to have like a good intra-abdominal pressure and support your spine. And sometimes after pregnancy or with people who have obesity, coordinate all those activities with movement and pelvic floor stabilization. And at the end, I always
And if you think of yourself as an entrepreneur, if you think of yourself as a business owner, if you think of yourself as somebody who will never do one of those things, it's okay, because we're all kind of, they're the people who are more missional in focus. It's like, obviously, like making more money as a clinician, making more shoulders that I don't want to handle anymore. And so we go back into your kind of JOB, go back into that, but you can grow into the person who can solve those problems. And so just recognizing, it's like, I beat myself. Exactly. Yeah. Number 7, I think if one thing can be changed in the like healthcare space in me, that got me to this point. And like David and I still surround ourselves
in pairs, 2 or more, 2 pathologies, some came 3 or more, 4 or more, in decreasing frequency. But what the pathology report would like us to remember is that there could be as many combinations as possible, like 230 different combinations were observed. So Alzheimer's disease came with some vascular progression of symptoms in children with bipolar disorder. So these are examples, and there are many combinations you can find in literature. But again, the caveat is make sure that they have been researched, studied, at least for their safety, first their safety and their efficacy. And the third part of the lecture is actually my introduction of the dance as a multimodal approach. Those in red are those who received the intervention, and those in blue were the controls. They did not receive the intervention. And you see that the neuropsychological test battery in this figure, the executive function in this figure, the processing speed and memory all were significantly better in those who